or shall
Yeah,
we start?
We can start.
Okay, no problem. So this is our first broadback seminar for this semester. We are very glad to have Ajahn Nopon. He is going to talk about his work, healthcare policy uncertainty and state-level employment. So you can, as always, you can share your questions via the chat box, or you can wait until the end of the talk. Ajahn Nopon, the floor is yours.
All right, thank you, Kapatan Atipat. So just for those of you who do not know me, I'm Paul. I specialize in health economics, and I'm actually an applied microeconomist. This work I'm co-authoring with...
I'm sorry, I forgot to properly introduce Ajahn Nopon. Ajahn Nopon is our associate professor. His work is mainly on health economics. He has a few publications. He also has several books, and he is an expert in microeconometrics. So it is a good chance that you get a chance to hear from him. And if you have any further questions, please talk to him. Ajahn Nopon, sorry, Kap.
No, it's all right. Thank you. So yeah, this work I'm co-authoring with a friend of mine, Jack Sheng, who's now based at the University of South Carolina upstate. And the title of the talk is Healthcare Policy Uncertainty and State-Level Employment. So the outline is this. So I'm actually going to introduce the subject a little bit, and I'll discuss the data and the methodology used in the paper. We'll go through the results at the aggregate level, and there are also some results at the state level as well, and then I'll conclude. So just to introduce the subject a little bit, I think it's important, if you look at the title of the talk, that you sort of need to know what healthcare policy uncertainty is. So I just want to highlight the fact that for this particular paper, the setting of the paper is the US. Yeah, so it's the United States. And there's a lot of uncertainty in healthcare policies in the US. A case in point is the Affordable Care Act. For those of you who do not know it, the Affordable Care Act was signed into law in 2010 under Obama, the Obama administration, and it was heavily debated all the way from 2010 up until up until currently, actually. It was debated in the 2016 presidential election, and it was challenged time and time again. And the last time I think it was constitutionally challenged was basically 2021, where the case of the validity of the act was brought up all the way to the Supreme Court. So there was a lot of uncertainty in healthcare policies in the US. And uncertainty in healthcare policies is rarely explored in the literature, even though it creates a lot of social costs. So you can see that uncertainty in healthcare policy leads to a lot of fear and speculation for consumers. Berinsky in 2015, for example, basically documented the summer of 2019, the summer of 2009, just before the ACA, the Affordable Care Act, was passed. And Berinsky discussed the fact that there was a lot of speculation and a lot of fear with regard to what the new law would do to people. The elderly people in the US, for example, were spreading rumors about how the Affordable Care Act would sort of have an impact on their end-of-life decisions. So there's a lot of fear and speculations when policies are uncertain. Healthcare policy uncertainty also creates a change in physician behaviors as well. Bachmuller et al. In 2016, for example, looked at behaviors of dentists and found that dentists changed their behaviors upon changes in healthcare policies. There is also a discussion of how policy uncertainty creates a change in government trust. And in one of our papers, Jack and myself, we published an article in Empirical Economics in 2021, and we found that healthcare policy uncertainty generates lower health expenditure and impacts GDP negatively. This is consistent with what well, this is the reference is incorrect. Actually, it's supposed to be Bloom. This is consistent with a paper by Bloom who says that healthcare policy uncertainty or uncertainty in policies in general creates a wait and see behavior. When people know the policies are uncertain, what they do is they typically wait and withhold making any important decisions. And that would imply that consumption would go down, investment would go down until policies are more certain. So up to this point, I hope everyone understands that healthcare policy uncertainty creates some sort of a shock to the system, and it reduces temporarily consumption and investment. In terms of the labor market, healthcare policy also has an impact on labor market decisions. And we could identify at least 3 different channels through which healthcare policy could have an impact on labor supply. So the first channel is pretty straightforward. If you have healthcare policies, you know that healthcare policies would have an impact on health services utilization, and health services utilization would impact health. And health is a pretty strong determinant of labor supply. So healthcare policies and labor supply are linked through the impact of healthcare policies on health. The second channel through which healthcare policies impact labor supply is through the occurrence of health shocks. If you think about health shocks, for those of you who do not know the term, health shocks is when you sort of become ill suddenly. Yeah, so you might be diagnosed with cancer, for example, and you're probably not sure what to do, or you might get hit by a bus, things along that line. When you have health shocks, you have to make a decision about the labor market. So your decision could be whether or not you want to actually get better and continue working in the labor market. You might also want to quit or retire early, or you might also want to move from work to welfare and obtain welfare benefits, unemployment benefits instead. Because there are several decisions that can be presented to you, all of those decisions we know are impacted by healthcare policies. Yeah? So if you have a healthcare policy that provides, say, for example, strong medical benefits, then people might actually have incentive to continue working and get better, for example. So healthcare policy certainly impacts labor market decisions through the occurrence of health shocks. The last channel that we could think of is the fact that healthcare policies impact the design of healthcare financing. In the US, the predominant system is what we call EPHI, or Employer Provided Health Insurance System. About 50% of the US non-elderly population basically have employer provided health insurance. So basically what that means is they have to work in order for them to obtain health insurance. Public health insurance in the US for the non-elderly population is actually quite limited. So certainly because employment and health insurance are linked with each other, hiring decisions and labor market decisions are made jointly with the decisions of whether to supply or to obtain health insurance. And that indicates that healthcare policy uncertainty and uncertainty in the labor market are extremely inextricably linked with each other. So now that we've established the linkage between healthcare policies and the labor market, let's look at what has been done in the literature. So the literature typically evaluates healthcare policy, but they rarely look at healthcare policy uncertainty. This paper by Feng and Zhao in 2018, for example, they looked at how the impact of the employer-provided health insurance system. They looked at the impact of employer-provided health insurance system on labor supply. So they did a simulation analysis, and they found that if the US health insurance system was switched to universal coverage, which is prevalent in European countries, then labor supply would fall by about 5%, because people would then have a lesser incentive to work. And we also can see in the literature that there are lots of papers on eligibility criteria of Medicaid and how sometimes there are contractions or sometimes there are expansions of eligibility criteria. And the contractions, expansions, or changes in eligibility criteria of public health insurance in general would have an impact on labor supply. But again, as I said earlier, there's not a lot of papers on healthcare policy uncertainty at all. There's only papers on healthcare policies in general. So what do we do here? So the research question for us is to evaluate the impact of healthcare policy uncertainty on aggregate employment, so aggregate meaning national level employment in the US, and on state level employment in the US. So our contributions are twofold. The first one is for us to basically explore the role of healthcare policy uncertainty on aggregate employment. So we, in addition to standard factors like aggregate demand shocks, sorry, someone is trying to call me. In addition to standard factors of aggregate demand shocks or market interventions, or even the economic policy uncertainty, we're now looking also at the impact of healthcare policy uncertainty on employment at the national level. We would also look at the role of national level healthcare policy uncertainty on state level employment. So, which is not something that's been done before. Probably there's a paper by Mumtaz et al. In 2018 in the Journal of Money, Credit, and Banking, which looks at the impact of macroeconomic uncertainty on state level employment. But the type of uncertainty that they looked at in that paper is the macro one that's not related particularly to health. So our contribution is through the consideration of healthcare policy uncertainty particularly. It's important also to contextualize our paper against the literature. So I just want to point out that our paper is very different from policy evaluation papers. We're not evaluating any healthcare policies. And so we're not trying to find the linkage between healthcare policies and the labor supply. That's not what we're doing. Our paper is also very distinct from papers investigating state level policy variations. There are papers like Wang et al. 2019, which basically look at how there are different states of different health policies and how those differences in actual health policies would impact the labor market. That's not what we're doing. Our paper is to look at healthcare policy uncertainty itself. And the distinction between policy evaluation papers and our paper is the fact that we're looking at different periods in the policy cycle. If you think about the policy cycle, yeah, so you know that in order for us to have a policy, you need to formulate the policy first. So you need to think about what would go into the policy, what the policy implications would be, and then you implement the policy. You look at the results of the policy, and then you might actually go back and reformulate the policy one more time or several more times. So the policy cycle is always like that. Yeah, so it starts with formulation, implementation, evaluation, reformulation. So in our case, what we're doing is we're looking at the periods of policy formulation and reformulation. So we're not looking at the periods of policy implementation, which is what policy evaluation papers do. So, so hopefully the distinction is clear to everyone. So that's what we're doing. It's also important for us to point out that our paper is very similar, methodologically speaking, to this paper by Mumtaz et al. And our results are complementary to our previous projects, which is Cheng and Vitrapong in 2021, where we look at the impact of healthcare policy uncertainty on macroeconomic variables. So the methodology. The methodology that we use, and this is probably going to be a surprise to John Paul, who earlier introduced me as an expert in microeconometrics. So the methodology that we're using for this paper is apply macro techniques. So we're using time series technique. So we're using a structural VAR model. So for those of you who are not familiar with structural VAR is sort of an unrestricted VAR model, vector autoregressive model. We impose some sort of restrictions into the model in a way that is distinct from a regular, normal, unrestricted VAR. Okay? So the standard form for structural VAR is this. Yeah? So you would have AYT, where A is the restrictions that we impose, plus D, which is the constant, and there is some lag terms of the Y, plus the error term, which is the mu. All right, so you have to also determine the optimal lag lengths. And for us, we use the Akai-Ike information criterion, and we identify that the optimal lag lengths for the data that we're looking at is 2. So we're doing that. We also use the Quinn-Hanan information criterion, and we get basically the same results. The Y vector, which is the vector of endogenous variables, consists of 8 different variables. So the first 6 are aggregate level variables, and the next 2, the last 2 variables are basically state level variables. So the first 6 are this. So you have HCPUT, that's basically healthcare policy uncertainty. It's measured as an index that's created by Baker et al. 2016. So this index is sort of, what the healthcare policy uncertainty index is constructed based on news articles about healthcare policy. So there's some keywords in the news, in the World News Access database, and basically the people who create the index, they scan over the database, and they use those keywords, and they identify the frequencies of the keywords over time, in which case they get an index based on the frequencies of those keywords. So that's the first variable. It's healthcare policy uncertainty index, and this particular variable is at the aggregate level. The second variable that we use in the model is HCE, which is real healthcare expenditure. And we include that second in the model to absorb the first moment shock to healthcare policy uncertainty. The third variable is GDP, which is self-explanatory. The fourth variable is PCEPI, that's personal consumption expenditure price index. Think of this as just the price index. Basically, CT is consumption at the aggregate level. EMT is employment at the aggregate level. FFR is the federal funds rate, which is very similar to the interest rate. And we use that to proxy monetary policy responses at the national level. The next 2 variables are at the state level, hence the I subscript. So SPI is a state level personal income, and SEMP, that's basically the state employment level. Yeah? So we have aggregate level variables and state level variables in the same vector of endogenous variables. So some of the variables are detrended with the filter proposed by Hamilton 2018. So in particular, all of these variables are detrended with the exception of 2 variables, which is the healthcare policy uncertainty, which is in log term, is not detrended. And the FFR variable, which is the interest rate, and that's in percentage terms. And the reason, for those of you who've done some sort of macro time series analyses before, you'll see that the filter here is actually different from the commonly used Hodrick-Prescott filter. We'll show later on that regardless of what filter we use, we get pretty much the same results. but we prefer the Hamilton filter because there's this paper by Hamilton himself in 2018, which basically suggests that the HP filter is generating spurious dynamics, especially at the end of the distribution. All right, so in order for us to estimate the model, instead of basically including all the state, instead of basically including all of the state and national data together in one huge matrix, we have 50 states, yeah, over a long period of time. And we have 8 different variables. So our matrix is actually going to be quite huge if we include everything in there. So we don't want to do that, because if you have a huge matrix, you run into this dimensionality problem. You're going to get inconsistent coefficient estimates. So what we do instead is we break down the betas, which is the Bn in the first, if you look at the first equation, that Bn, we break it down to 2 different blocks. So we have the aggregate level block, and then we have the state level block. And we impose what we call the exogeneity assumption, where we say that the SPI and the SEMP variables, the state level variables, are not having any impact on the first 6 variables in the matrix. So we impose the condition that the coefficients are going to be 0, going from SPI to going from the state level variables to the aggregate level variables. The assumption, in a nutshell, basically suggests that we think the state level variables are not going to have any impact on aggregate level variables, but aggregate level variables would have an impact instead on the state level variables. So that the exogeneity assumption is very common among papers that look at different levels of data, different levels of observations. Right. So ultimately, we for the first equation that we have, and then we basically pre-multiply the first equation by the inverse of A, and the inverse of A is that's the matrix of restriction, that's the matrix of restriction. So A is a lower triangular matrix. We set on the principal diagonal, it's 1 all the way. And we have some restrictions there where we suggest that healthcare policy uncertainty impacts all the other variables contemporaneously, but not the other way around. And once we do that, we get the standard VAR equation, which is something that probably all of you have seen before. And we get this last equation here, where the epsilon t is a vector of structural shocks. So epsilon t is basically what we're going to use in order to shock the system and get some results. And so the data that we use are quarterly data from the FRED database, that's Federal Reserves of St. Louis database. And we use some data, the Healthcare Policy Uncertainty Index comes from the Economic Policy Uncertainty website. Of course, I was talking about the dimensionality problem earlier on. We borrowed the technique from Givens and Reed, 2018, where we separate the betas into 2 different blocks. We use modified codes from Schmidt, Grohe, and Yui in 2018 to estimate the model. So let's now look at the results. Yeah, so I'm separating the results into different blocks so that they're easier to follow. So let's look at the aggregate responses, or the national level responses first. So you can see that there are basically 6 figures on the screen right now, and these basically refer to the first 6 national level variables in the matrix of endogenous variables. So what we do here is we shock the system, we shock the VAR with a 1 standard deviation positive shock of healthcare policy uncertainty, meaning that we provide the VAR system with an unexpected increase in healthcare policy uncertainty. Yeah, and we find that let's look at two important results here. We find that employment basically falls immediately and it goes back up. Yeah. And same thing with GDP, it falls and it goes back up. That tells us that a positive shock or an unexpected increase in healthcare policy uncertainty would induce reduced employment and reduced GDP at the aggregate level. And the results are the negative impacts last for about 2 quarters. The next thing we do is for us to look at the historical decomposition, especially during COVID-19. You can see that our data basically covered the period of 1985 all the way to 2021, the last quarter of 2021. So we know that our data covers the COVID-19 period. And what we want to do in this exercise is to see if healthcare policy uncertainty would hold up against an exogenous major public health shock. So what we do is we decompose the 2019, we decompose the data from 2020 Q1 onwards, and we perform a counterfactual analysis. So the black line, the black solid line that represents the actual change in employment, aggregate employment in the US. So you can see, for example, in 2020 Q2, which is the first wave of COVID-19, unemployment in the US drops by about 12%. Yeah? So that's the black line. So we do 2 counterfactual analyses. So the first analysis that we do is when we introduce absolutely no structural shocks at all. So we say that from 2019 Q4 onwards, there will be no structural shocks. So the epsilon in the VAR system there is set to 0. And we get the red dotted line. Yeah. So that tells you that the employment, given absolutely no shocks to no major economic or macroeconomic shocks in the system, the unemployment level would still continue to rise. Yeah, and it would continue to rise at about 2%, right? All right. Then we do the second counterfactual analysis, which is when we introduce only the healthcare policy uncertainty shocks in the system and shut off all the other shocks. So there will be no GDP shocks, no FFR shocks, nothing in the COVID, in the VAR model, just the healthcare policy uncertainty. And this is represented by the blue line. And you can see that with the blue line, when we introduce healthcare policy uncertainty, the employment level drops, and it drops about 2% out of the total 12% drop in the first wave of COVID-19. And that gives us confidence that healthcare policy uncertainty still has some explanatory power, even in the presence of a major shock like COVID-19. And it tells us that we're basically on the right track when we look at healthcare policy uncertainty. All right, so that's the national level results. We then move on to look at state level responses or state level results. And as if you remember from the metrics of endogenous variables that we looked at earlier, so there are 8 different variables. Yes, so I already talked about the first 6. So now moving on to talk about the last 2, which is when we have state income and state employment. So with state income, you can see that there are lots of different lines here. So the black dotted line that represents the average response of all 50 states. So as I said earlier on, we run VAR, the structural VAR model 50 times, each time for each state, yeah? And then we plot the estimated income responses, which are the blue lines on the diagram. Then we average the responses and we get the black line on the diagram. Yeah, so the black line is the unweighted average response, unweighted average income response. So you can see that the income response is actually not very far away from 0 at all, and this is not statistically significant. So we say that healthcare policy uncertainty doesn't really induce significant changes on state income on average. It has a strong impact on state income for some particular states, but overall it's not statistically significant. We then move on to look at state employment, which is the sort of the key message that we want to convey in the paper. And we find that upon having a healthcare policy shock, state employment goes down quite significantly. So if you look at the black dotted line, yeah, so state employment goes down quite significantly, and then it rebounds back. And it takes about 8 quarters for state employment level on average to basically go back to the 0%. Yeah, so that tells you that the shock lasts for about 8 quarters on average. So if we look at the employment results, the state employment results in a bit more detail, we get this table. So this table is the estimated employment responses, so the impulse responses, the state level employment responses to a 1 standard deviation positive shock of healthcare policy uncertainty. If you look at the average, you find that at impact, at 0 quarters, when there's a healthcare policy uncertainty shock, state employment would fall by about 0.31% on average. And it keeps on falling until 8 quarters. Yeah, so that's basically what you see. So there's a shock at that level. And if you look at the minimum and the maximum, you can find there are lots of variations across states, which is something that we'll look into later on. But the key message for this particular page is that we have a negative response in terms of employment when there's a healthcare policy uncertainty shock. We also look at forecast error variance decomposition. So we decompose the forecast error variance, and we find that healthcare policy uncertainty basically explains about 4 or 5% at impact of the variation of employment across states. And we find that the explanatory power of the healthcare policy uncertainty increases a little bit over time relative to all the other endogenous variables. And that to us is a little bit surprising. But overall, I guess the key message for this particular slide is that healthcare policy uncertainty has a strong explanatory power with regard to variations in employment. So we want to be a bit more confident about our model. So what we do is we perform robustness checks, and altogether we do 7 robustness checks. So the first thing we do is we include the economic policy uncertainty index into the specification. If you remember, the endogenous variables metrics consist of 8 different variables already. So we add the 9th variable, which is the economic policy uncertainty index developed by Baker et al. 2016. So we place the economic policy uncertainty index first in the model, and then we see what happens. Yeah. We also include the macroeconomic uncertainty index developed by Jurado et al. 2015 into the model as well. And that's our second robustness check. The third robustness check that we do is we replace the economic policy uncertainty index and the macroeconomic uncertainty index with the financial uncertainty index developed by Ludvigsen et al. 2021. So in case you're unfamiliar with the uncertainty literature, so as I said earlier on, healthcare policy uncertainty is based on news articles about healthcare policies. And to create an index on healthcare policy uncertainties, what we do is to look at whether to look at the frequencies of how healthcare policies are mentioned in the news. Yeah. Same thing with economic policy uncertainty, because the 2 indices were both developed by Baker et al. So with economics policy uncertainty, we do the same thing. So we scan over the World News Access database, look at terms related to different types of economic policies, find the frequencies of how those terms are being mentioned, and create an uncertainty index based on the frequencies. Yeah? So that's the first index. The second index by Jurado is a little bit more complicated because this is macroeconomic uncertainty index. So they look not only at the policy particularly, but they look at macroeconomic uncertainty overall. So what they do is this, so they gather like a large set of macroeconomic series, and they separate the macroeconomic series into 3 different categories, if I remember correctly. So they have the first category is sort of variables related to real activities in the economy. The second is related to price, I think, and the third one is related to the financial markets. And what they do is they try to create sort of forecasts and identify forecast errors. And once they get forecast errors of all series in their data set, they find a common component in the volatilities of forecast errors. And they use that common component as the macroeconomic uncertainty index, because that common component would change over time. So similarly, Ludvigsen et al. And some of the authors in the Ludvigsen 2021 paper are basically co-authors in the Jurado 2015 paper. They generate another index called Financial Uncertainty Index, which is constructed very similarly to the Macroeconomic Uncertainty Index. The only difference is that instead of looking at 3 different groups of variables, real activity, price, and financial market, the Ludvigsen paper generates a financial uncertainty index only based on the financial markets data. So nothing else. Yeah. So all of these indices, the 3 indices here in the first 3 robustness checks in our paper, they're included first in the VAR model, which then suggests that these variables would exert contemporaneous effects on the other variables in the model. So because there are a lot of students here, let me provide a further explanation. When you do a structural VAR system, whatever you include first in the model, so the first variable you include in the model exerts contemporaneous effects or has an impact basically on the following variables. And there's a sequence in terms of the impacts. So the first variable impacts the second variable, then impacts the third variable, and impacts the fourth variable, etc. Yeah. So in the first 3 robustness checks in the structural VAR model that we have, we include these variables first. Yeah. The 4th robustness check is when we change, we keep the same endogenous variables metrics, and what we do is we switch the Schleski ordering. So when in our baseline model, we order healthcare policy uncertainty first. Now we order healthcare policy uncertainty last in the aggregate variables series. So we expect that the GDP, the federal funds rate, the consumption, etc., would have an impact on healthcare policy uncertainty as opposed to the other way around. So this is for us to test whether or not the ordering matters in terms of the results. The 5th robustness check that we perform is for us to relax the exogeneity assumption. As mentioned earlier, in the baseline model, we impose an exogeneity assumption where we say that state level variables would not have any impact on aggregate level variables at all, assuming that the linkage from state to aggregate is completely exogenous. Yeah, so there's, or non-existent to be more precise. In this robustness check, what we do is we relax that assumption and we allow state level variables to have a feedback on the aggregate level variables. The sixth assumption is when we introduce spillover effects across different states. So we developed this method by Bayanang in 2002. And for those of you who are familiar with the applied macro literature, the method that we're using is very similar to the factor augmented VAR models. But what we do here is not factor augmented VAR. So what we do is this: we include 50 state state level variables from 50 states. So we have employment variables and we have income variables from 50 states over the period of 1985 all the way to 2021. And we do a factor analysis and generate 7 different factors based on an algorithm created by Bayanang in 2002. So we get several factors, and those factors basically measure some sort of variations across different states in terms of income and employment. And out of those 7, we pick only one factor, which is the principal factor that explains the most variation, and include that into our VAR model, just to see if that would have any impact at all. And that principal factor is supposed to capture some sort of spillover effects because it captures the variations of employment and income at the state level. The final robustness check that we have is to use, in place of the Hamilton filter, to use the Hodrick-Prescott filter, which is the more commonly used filter in the literature. Because we have quarterly data, we use the standard smoothing parameter of 1,600. So the results are this. So you can see the black line, the black solid line that represents the baseline results, and everything else represents robust results from the first 3 robustness checks. So you can see that there's actually a drop in state employment at the beginning and picks up after the first quarter for all 3 robustness checks. So the magnitudes are obviously different, but you can see that they behave quite similarly. And then there's the same pattern here. So we would say that qualitatively speaking, our baseline model is fine. And the inclusion of the economic policy uncertainty index, the inclusion of the macroeconomic uncertainty index, and the inclusion of the financial uncertainty index, really, they don't particularly change qualitative results of the model. Same thing with this diagram. So here we have the baseline results, which is represented by the black line, and then the other 3 series that you see refer to robustness checks 4 to 6. So again, the same pattern emerges. So we can see that the state level employment on average would go down and it would pick back up after the first quarter. And similarly, when we use the HP filter as opposed to the Hamilton filter, the employment level goes down first and then goes back up after the first quarter. Same thing with GDP. So just based on the robustness checks, we know that the baseline model that we have is not sensitive, at least qualitatively, to different model specifications, to detrending methods, to data smoothing methods, to different assumptions of the VAR model. So we're pretty confident about the results, at least qualitatively. Just moving on, earlier when we talked about state level results, and we looked at the results at the average we looked at results for the average estimated responses. I mentioned there that the state level results, they vary across states. In order to see why is it that they vary across states, we perform cross-sectional state level analysis. So with the cross-sectional analysis, we have several dependent variables. So we run several regressions basically, and these are just regular linear regressions. So the dependent variables for the regressions are the estimated employment responses at different time horizons. So we have the time horizon of Q0, so that's the 0 quarter horizon. And then we have the 1st quarter horizon, the 4th quarter horizon, the 8th quarter horizon, and 16th quarter horizon. So these are cumulative impulse responses for employment. Okay? And the explanatory variables we include in the model are selected strategically. So we basically look at several groups of state level variables. So we collect data on variables representing financial frictions, industry composition, fiscal indicators, labor market rigidity. So these are basically variables that are typically used to represent frictions in the market and are typically used to explain heterogeneity across states. But we also supplement these variables with population characteristics. So we collect information on, for example, percentages of white population in each state, percentages of female population in the states, percentages of legal residents in the states, baseline population health, etc. We also include demand side and supply side factors related to the health services market as well. So ultimately, we collect about 3,000 state level variables going as far back as possible. And we get them from several sources like the Bureau of Economic Analyses, the Kaiser Family Foundation, etc. And once we have those variables, we average the state level variables over time so that we have a cross-sectional data set. Yeah? So the dependent variables are basically cross-sectional. So say, for example, for the estimated employment responses at Q1, we have about 50 observations. So 1 observation per state. So what we have to then do is to average our explanatory variables over time so that we also get 50 observations for each variable that we include in the model as well. So we pick the specification with the highest adjusted R-square, which is a method that I think makes the most sense. In the applied macro literature, sometimes they do what they call the leaps and bounds algorithm to find the best possible specification. Well, I didn't do that personally because I didn't know how to do the leaps and bounds algorithm. So what I did instead, what we did instead for the cross-sectional analysis was to basically just scan over several different combinations of state level variables and come up with the best possible fit in the model. And the final specification that we found is this. Yeah, so I'm not going to go through everything here because I think we're running out of time, but let me highlight just the variable that is statistically significant throughout, which is the right to work legislation. For those of you not familiar with the legislation, the right to work laws in the US is a legislation that prevents sort of union security agreements. It allows workers to not have to be a member of a union in order for them to enter a work agreement. Yeah, so if you have a right to work legislation, that means that you have a more flexible labor market, basically. And because our estimated employment responses are all negative, when the coefficients of the right to work legislations are positive, that implies that states with the right to work legislation, they have a smaller reduction in employment responses compared to states without the right to work legislation. In other words, the more flexible the labor market is, the less of the negative impact the states feel. Okay? So just to conclude, I think I'm running out of time, sorry. So, all right, so just to conclude, so the paper basically suggests that healthcare policy uncertainty has an adverse effect on aggregate employment, and that lasts about 2 quarters. healthcare policy uncertainty also negatively affects state level employment as well, not just aggregate employment. So we would say that healthcare policy uncertainty shocks, they behave in a manner that is consistent with a negative aggregate demand shock, which is a conclusion that we found in our earlier paper, Cheng and Vitvarapong in 2021. And we argue that healthcare policy uncertainty is an important determinant of aggregate and state level employment, and is something that should be further explored in the literature. And finally, because of the results, we suggest that the government, the federal government in particular, needs to have constant and effective communications and reduce unnecessary uncertainty, which would then lead to speculations and lead to wait and see behaviors where people would stop or withhold from making important economic decisions, which would then have an impact on the economy in general. So that wraps up my talk. Thank you very much. Sorry, I went over time.
Thank you, Ajahn Ming. That is a very comprehensive presentation. Is there any question from the audience? No question so far. Okay.
Sorry.
Okay.
Okay.
อาจารย์นพพลครับ so is there any way we can, let's say, like draw the implication for a developing country like Thailand?
Yes, I guess. That's a bit difficult. That's a little bit difficult to say, but I guess you can, because I think uncertainty in any economies at all would have a negative impact. But we don't know about the magnitude of the impact. And when we talk about uncertainty, we assume that people are aware of the uncertainty. So in this case, we basically assume that people read the news. Yeah, and then people would have sort of a speculation as to the directions of the economy. For developing countries, if the same assumption holds, that is, we expect people to read and to be aware of all the news, then we would expect that the results that we see in this paper would also carry over to developing countries as well. But I think that's something that we can actually test empirically.
We have a question from Sunil.
So yeah, so Sunil, so I can actually read the questions if you, yeah, so because I see that you were actually about to go somewhere. Sorry.
Okay, don't worry.
Sunil was talking about how we could actually do like subsample analyses and look at look at groups of different states based on the right to work legislation. The answer is yes, I guess we could do that, but I'm not sure. Well, I guess we could do that. We would expect the results to be quite similar across the two groups of states anyway, except that the heterogeneity would probably be a lot less, where there'll probably be a lot less variation for states with the right to work legislation compared to states without the right to work legislation. But that again is an empirical question, and I guess we could explore that. Sunil was also talking about the macroeconomic variables. Oh, okay. So he was asking whether or not there are errors in the variables and how the errors are accounted for in the VAR model. You're not wrong there. I think there are definitely errors in macroeconomic variables and something that we're aware of. I think there's nothing we can do because that's the best possible that's the, well, not the best possible, but that's the, using those macro variables is the only option that we have in order for us to look at macroeconomic behaviors. So there's not much we can do, but we could address that as part of the limitation of all macro models moving forward. So hopefully that answers your questions.
Okay, thank you, Ajahn.
Thank you.
So if you look at, let's say, provincial level uncertainty, I think that this happens every year, right? When we go through the budget process, and not only about like health policy in many areas, education. For example, there is like a decision to cut or to increase or to allocate spending across provinces. Is there any chance you can like do the same for Thailand?
Yeah, I think Pipong Ajampongsak has done something along that line, but he doesn't actually look at budgetary uncertainty. I think he looks at political uncertainties. There's something that we can do there. I think we can certainly try. Yeah. So yeah. So I guess we could try. But the way we would do that would be slightly different. Well, we could actually do it the same way as how the Economic Policy Uncertainty Index is created in the US by looking at frequencies of news over time. Yeah, but that's something we could definitely explore. But I have to think a bit more about that at the provincial level. But normally everything that we do would be at the national level with the uncertainty index. That's because news are spread nationally, yeah, as opposed to provincially. Yeah.
Yeah. I think if we look at local news, like local Facebook group, for example, they are talk about this among like องค์การบริหารส่วนจังหวัด about like whether they will receive like more allocation, whether they are going to get a budget cut on certain area. Right? This is definitely what is going through their mind of those like local policymakers.
Certainly,
yeah. But the difficult thing is to combine it and to make like to create an index out of this.
Right. You're right.
Yeah. That's the difficult part.
Yeah. I mean, yeah. So I think the first thing when you try to create an index, you need to have a set of variables upon which you create the index. And it's important to actually get that set of variables, first of all, and it's important to have economists or social scientists agree upon that set of variables first. Because the selection of variables into the index creation is definitely what is driving the index itself.
Yeah.
The method is quite simple. I mean, you can do a simple factor analysis and you get an index anyway. So just like when
we can definitely talk about this. I think it's a pretty big deal for local policymakers.
Right.
On the fiscal side, yeah, there are, I think, so many uncertainty, especially during the COVID-19.
I agree. Okay, thank you for that.
Okay. Yeah. All right. I think this is 1 o'clock already. So if there is no further question, I think we can conclude the round back now.
I don't have a question.
Go ahead.
I have one request: how to get this presentation to read again?
Sorry, can you say that one more time?
I want to read this presentation, so where to get the access of this presentation?
I think it's published already, right?
No, it's not. But I have a paper that's published already, and I can actually send that to you if you give me your email address.
Okay, I will write to Ajahn. Okay.
So well, my earlier paper with Jack was published in Empirical Economics in 2021, and you can actually go ahead and read that paper first. So that
it's different one. I thought it was the same one.
Different. So there's a 2021 paper which has been published already, and this paper that I'm presenting today, that hasn't been published yet. But the idea of the two papers are actually quite similar. So you can start with that one first, and then when the second paper gets published, then I'll be happy to send it to you.
Okay,
thank you.
Thank you, Ajahn.
ครับขอบคุณครับ thank you so much อาจารย์นพพล and thank you very much to the audience. The recorded of this presentation will be made online too, so stay tuned and thank you very much. See you next time.
Thank you.
Thank you, Ajahn. Very interesting.
Thank you, Ajahn. Very interesting paper. Yeah.
Thank you.
ครับขอบคุณครับมิงไว้ว่างๆเรานัดคุยกัน
ได้ฮะสวัสดีครับ
ครับสวัสดีครับมิง
Oh, okay.